So I'm Tracy Hansen, the administrator here at the Keystone Care Center, and I've been the administrator since 2011. I started working here as a CNA in 2008, and then I became the second shift charge nurse as an LPN, and then the first shift charge nurse and care plan coordinator. I received my RN license. Then I was the assistant director of nursing, then the director of nursing, and then I became the administrator in 2011. We have a lot of people start working here that don't have any education, and so we send them to school to get their licenses, their CNA certification, LPN license, RN license. We push for higher education and sending people to school. We have scholarships for that. We have one employee we're paying for right now to get her RN degree, so it's a 3-year commitment if you stay working here.
Wow.
We went skilled in 2011. So we were able to take patients who needed rehab back to their homes, such as having a hip replacement, pneumonia, any kind of thing that they might need therapy for. We could then take those patients, use their Medicare benefit, rehab them back to the community. Once we started doing that, we did that for a while. We increased the assistance that we provide in our assisted living. So our assisted living was more ran like an independent living, but now it's run like an assisted living. So for instance, we can give people medications, baths, help them with dressing. They get 3 meals a day. There's an RN on call 24/7. So we just kind of increased all of those services back in the assisted living. When I took over, it was half full, and now it's full all the time with a waiting list. So I think people like those services. A lot of times we'll transition people from the care center to the assisted living. And then we have an independent apartment, so we transfer people from the assisted living even over to the independent apartments, or vice versa, people from the independent apartments to the assisted living. When we saw a need for more Meals on Wheels services, we started providing Meals on Wheels services in the community. We had previously had volunteers deliver the meals, and we had about 7 meals a week in the town of Keystone, and now we deliver 520 meals a month all over Benton community. So we're in Van Horn, Atkins, Elberon, you name it, in Benton, we're there delivering meals.
Awesome.
So then once we started doing that, we saw that there was more of a need for people to have some extra services, so we launched our home health a couple of years ago. And we have about 30 patients on our home health service right now. It's growing rather rapidly, but we can go into the community and help people in their homes. For instance, if they have some kind of surgery or need some kind of therapy and they're not quite sick enough or not well enough to come to the nursing home, they can stay in their home and we can go and take care of them in their home. And then even if they didn't have surgery and maybe they're at home and they just need somebody to come in and prepare a meal for them or help give them a bath or get them dressed, make sure they're taking their medicines, we can do all of those things in the home now to try to keep people in their homes longer. This allows them to stay in their house longer than having to come to a facility once we get in there. Some people will call me and say, I think my mom needs to come into a nursing home or my dad needs to come into the nursing home. And really they don't need to come to the nursing home. They just need somebody to come in and help them take a bath a couple of times a week, or they just need help with us treating their wounds or making sure that they're taking their medicine. Because once people get aligned with taking their medicine and getting good meals, they can usually stay home a lot longer than they would if that wasn't on track. Well, there's only so many Medicare and Medicaid dollars and so much money your insurance company wants to pay, and so that's the big push right now, especially with the managed care organizations in the state of Iowa. They want you to stay home. They don't want you to live in a facility. It's going to cost you a lot more to live in a facility. So what kind of services we can provide to keep you in your home longer to save the federal government, the state government, money overall. It's just a better way to go. But yeah, a lot of employees we tell that we pay for higher education. So if they want to go to school to better themselves, to get an RN degree, or maybe to learn more about the dietary department or anything like this, we assist with paying for those things. Not only that, we pay for 75% of all of our employees' health insurance. And that's unheard of in this market. Usually people come in and they're paying 3 times more than what we would be offering them for health insurance. Our company is community owned. It's a corporation, but it's owned by shareholders in the community. So we give money back to the corporation, back to the company and the employees. So our employees now have the option to have a 401k. That's something we added a couple years back. So we have a 401k, and 50% match up to 6%. And, when I called a lot of the companies that surround us that are doing the same type of business, they don't offer anything like that. We're right there with everybody else. Either we're a cut above or we're paying the wages that everybody else around us are paying. We will pay for more experience. So those are all good things, I feel. We recently started a big push for employees being healthy. So we had a competition where we did a step challenge. We bought pedometers for every employee in the company, and we had a chart up to see how many people can get how many steps, and the people that won then would win devices such as Fitbits or fitness-related equipment. We added a gym membership. You can get a 10% discount to the gym if you want to go to the gym under the company. We've done lots of things like that, just pushing forward into the future and making sure that we have healthy, happy employees.